Okay, we're moving on to asepsis now, okay? Because Ashwin is planning to get everything ready for that ideal patient that comes in who wants sinus grafting. Okay. I've suggested to him that if he gets everything ready and he has any patient come in, however poor, he should do some implant work for a reduced price. Okay. Now, in the asepsis presentations, we look at disinfection and sterilization. The difference between a sterile situation and an aseptic situation. Cross-infection control. We look at the items needed, which we've gone through quite extensively. Instrument processing. Things have really advanced tremendously in the UK and in India since I've been involved. The fact that the amount of vacuum autoclaves in India now is increasing tremendously. Do you have one yet, Ashwin?
Yes, I have.
You have? Okay. How to arrange instruments for surgery. The duties of each member of staff when you're doing surgery. It'd be very nice, Ashwin, not only to have your regular staff, but on times when you're doing implants, if you had a sort of part-time person that could come in and help you as well, that would be very nice. We can look at instrument passing in implant work. So the objective of cross-infection control is to prevent the transmission of infection from one person to another. This has become so much more relevant now compared with when I started off, and certainly since the virus, the COVID virus. So this is fairly routine for you now. We need to create and maintain a safe clinical environment for patients and staff. Possible infection transmissions from the clinician to the patient, from the patient to the clinician, and from one patient to another. The objective is to prevent contact of blood and saliva with skin abrasions and cuts. This is on ourselves, the clinicians and staff. Saliva is invisible yet capable of cross-infection contamination. We need to prevent damage from sharp instruments such as needles and scalpels. And some of you have seen this syringe, which I wouldn't want to work without this syringe now, knowing what I do. The stress that you all go through worrying about the needle that might be infected with various diseases is constant. And you don't know this so much as when you get a syringe like this, which is safe, where the needle is covered, and you're not putting a cover onto the needle or putting it in a special holder. And also the way this needle is removed from the syringe is so good that it's totally and utterly safe. It wasn't until I got this that I realized how much stress I went through worrying about sticking the needle in myself. We need to prevent the transmission of patients infected with highly transmittable diseases, such as hepatitis B, C, AIDS, syphilis. And do you get West Nile disease in India, Ashwin?
remember what is West Nile disease.
I don't know. It's something that people in America worry about, okay? It may not be a disease which you worry about in India. You've got enough already. So any bodily fluid may contain any of those infectious agents. The objective is to prevent the transmission of oral fluids and debris contained infectious material from the patient to the surfaces, to the equipment, and to materials from the hands of the worker. Let me just go a little bit faster with this. I'll send you this so that you can look at it. When you get to the stage, Ashwin, of doing
Hi, welcome back.
Yes, sir.
Burnt corn, burnt corn.
I tried cooking in gas flame, so that's like we don't have those traditional fireworks, so I tried in
Okay.
gas stove, so that's why.
Okay.
Where did he go, sir? I'm the only person who is not able to see him, or
No,
He's just back.
okay. I thought I was not able to see him.
I think you're on the speaker view. You have to go to the gallery view.
Okay.
Can't hear you, sir. Unmute. So you keep one monitor only. You have headache to have 2-3 monitors.
how's this now?
Now it's good.
You can hear me, okay. As I was saying, Ashwin, when you start doing implant surgery, you need to double bag everything.
Yeah.
Okay. It's all very well not double bagging for routine dentistry because you're not using sterile surfaces. You're not using aseptic surfaces. So if when you're opening the bag, if the bag touches the surface, it doesn't matter. Okay. When it's using aseptic, when you open a single bag, you can make a mistake and contaminate the surface. Whereas with a double bag, you open it and the assistant takes that bag that's inside away, okay, and you're less likely to contaminate. So if you see this, now, just 1 second, these two people in this,
No, I
there is
cannot see. Not started screen sharing.
Is that sharing?
Yes.
Okay.
But it's zoomed up. It's very big. Can you maximize the screen? Let's see how. Yeah, that's better.
How is that now?
That's better.
Okay. Now you need to practice this. You've got a sterile surface there, an aseptic surface, and nobody must go within about 6 inches of it. Otherwise it'll be contaminated. So we've got the assistant there who is gowned up and has got sterile gloves on. And you've got the roving assistant on the right there. And they're going to pass each other now. And the person on the right wants to go to the left. And that person on the right is going to say, coming through. And they're going to go past each other back to back. Okay. So they're not going to contaminate the front of the gowned patient, assistant. And they keep 6 inches away from the Mayo table there. And Ashwin, you need to practice this with your assistants. Now, this is on the left there, a friend of mine who's an accountant. And he's just come to help me make these videos. And I've just taught him previously how to open a double bag without contaminating it with his hand. Now he's going to push it forward to indicate that the surgical assistant can take that from him. You notice she's got her hands in the praying position, so her hands don't go all over the place. And the used paper is thrown on the floor. That's picked up later. Tejas was saying, you know, I was mentioning about using tin foil to put over the light handles.
Yes.
He was saying that tin foil is expensive. Is that right?
Yes.
Yes.
Compared to plastic wrapper.
Really? Okay. This Mayo table, which is attached to the base of the chair, has been absolutely wonderful. This is the implant kit. These are the expansion instruments. That's the implant motor. Ashwin, do you know if you can, are you there, Ashwin? That implant motor cable is sterilizable.
I didn't know that.
Mine is, okay, and it makes such a difference because if this is not sterilizable, you have to use a sleeve to cover it, which is a real pain. Do you have an implant a motor and system, Tejas?
Yes.
You need to check with your manufacturer to see if that is sterilizable.
I'll do that.
Okay. You need to do that as well, Ashwin, okay? Okay, Ashwin? Yeah, good, okay. So once the instruments are open, these instruments here, are not sterile anymore. They're aseptic because of the bacteria in the air. That's the tubing, the saline tubing that goes to the motor from the bag of saline. So this is putting the tinfoil on, which, as I mentioned to you, has the advantage you can hear it when you contaminate it with your head. Now, you're going to be using most probably disposable syringes to give you a local anesthetic. This is how we would put the needle onto the syringe. You'd have to adapt it to how you work with the disposable needles. So your surgical assistant would hold your plastic syringe, and somebody else would come along with the needle and push it on in the same way. That would work, wouldn't it, Tejas?
Yes.
Okay. You see, my attitude towards asepsis for this sort of work is, if you're going to do it properly. Don't make mistakes all the time. And you have to become really aware of when infringements occur in the aseptic field. Now, in our instrument pack, we have a scalpel and the scissors and the peristyle elevator, and also a scalpel blade in its packet. So it's already in the pack, ready to be put onto, for the blade to be put onto the handle. Most people I've come across, they have to hand the assistant the needle, the blade in its packet, which means that the packet has to be sterile. Whereas in my situation, the instruments and the blade in its packet are sterilized at the same time. So she's now pushing the blade onto the handle. And once this is all set up, she's going to move that Mayo table round over the patient. Then she's going to stand waiting like this. So that's the setup for some implant placement. Here the surgical assistant has draped the patient. They've prep the patient with betadine, and then put the drape over the patient. Now, here's the assistant ready for us to do surgery. Unfortunately, masks, to me, I have certain doubts about them, because in a non-aerosol, in an aerosol situation, you should change your mask every 20 minutes. What do you feel about, what do you feel about that, Tejas?
Why?
Because the mask gets filled up with bacteria.
Do you actually do that?
No, but these are the facts about masks.
And the surprising thing to note is, during the pandemic, when there was an acute shortage of the masks in the first wave last year, N95s were sold out, or they're not available, and these regular 3-ply masks, some people use them for about 20 days, the same mask, same damn mask, and they didn't get sick.
That was good luck rather than scientifically acceptable.
Yes, it is what it is.
Yes. No, I mean, I know that occurs, but the reason why I'm showing you this, and if there's a non-aerosol situation, you should change them every 60 minutes. The fact is that most people use the same mask at least for all the morning and a new one for the afternoon, or the same one all day.
Yes.
The reality of the effectiveness of that is ridiculous. And I think that a shield is effective, because the shield doesn't build up with the bacteria the same way as the masks do. What do you see wrong here, Abby?
It's below the nose.
Absolutely. I have a friend who does all sorts of implant work, and he's sitting there next to the patient and his assistant, and they both have their noses showing. It's ridiculous. Also, no eye coverage. Okay. This person has no eye coverage and no hair coverage. And here's no mask. Now, when you're wearing a mask, when you're wearing a gown, you have to consider that this is the sterile area. Okay. You don't put your hands onto your lap. That is not considered the aseptic area, or around the back of you. This is the only area you can accept as being aseptic. What's wrong here, Akshaya?
like he's touching on the Mayo table or whatever is there.
No, he's lifted up a sterile pack from a sterile surface, and he's brought it over, so that's okay.
Other hand.
The other hand's touching the, okay.
Okay. Now, I was taking these photographs and I didn't notice it because I was concentrating on photography. Okay. This person should re-gown and re-glove. Okay. You see, this person has got eye protection and a mask, but no hat on, no cap. This was taken, that photograph, that picture was taken, and this one was from a video, from a CD video on asepsis, and this one was in it. And the photograph was showing her mask and glasses. But look at this. So many of the photographs in this CD were totally wrong. You need to make sure your staff are using heavy-duty gloves when they clean instruments. Do you have some of these, Abby?
Yes, sir.
Good. Okay. Do they at your clinic, Anand?
No, sir.
No. Normal gloves are not good enough. Okay. They're quite likely to stab themselves with instruments when they're cleaning the instruments. We used to scrub our hands when doing surgery, but this damages the skin and brings bacteria to the surface. So we need to use synthetic sponge like this. If you ever get Tejas something sold to you and it's got covering like this, which nowadays is quite frequent in the UK, then take these little things and cut them into this particular shape, roughly this shape, okay? And use this for cleaning hands rather than brushes. Now, I don't know what you do now in routine dentistry, but I believe, and I'm happy for you to tell me I'm wrong, that you wash your hands at the beginning of a session. You wear non-sterile gloves while you're doing procedures. Between patients, you take the gloves off and you use non-alcohol hand disinfectant. And then you put on new gloves. If you leave the room and go and do some things outside the room, like going to the toilet or somewhere or other, then you have to wash your hands again using the wash hand routine. Is that acceptable to you, Tejas?
No, I wash hands at the beginning of and before and after every patient.
Yeah, I'm not sure that's necessary if you're wearing gloves and you're using hand disinfectant.
I don't know,
But-
maybe COVID, I'm a little paranoid, but yeah, I want to
Yeah.
wash before and after.
Yeah, it would be interesting to get that checked out. I mean, you can't be criticized for doing that, Tejas, but I'm not sure you need to. If
Okay.
you're using the hand disinfectant.
Yes.
I mean, just taking off the gloves and putting them under your hands under the automatic sprayer, and then rubbing your hands around, and then putting your next pair of gloves on, is such an easy way of doing it. But we need to check that out probably. Now, when you're doing surgery using aseptic technique, and I'm talking about implant type surgery where you may be putting a foreign body into the body, i.e. an implant, or you may be putting in graft material. I don't believe you need to go through this if you're removing teeth, or even wisdom teeth. Anyway, the first thing you do is to take your jewelry off, because these can harbor bacteria and they can perforate gloves. You put on a hat. This is fairly routine now, so I'm going fast through it. The water, and I'm talking about in Europe rather than India, because you all have cold taps. Do you have hot taps in your surgery, and Ashwin?
Swan tap, sir?
The taps in your surgery, are they all cold taps?
Elbow.
Or do you have
sorry?
Do you have hot taps and cold taps?
No, only cold taps.
Only cold taps.
The hospital I do GA surgeries, they have hot.
Okay, so when you're washing your hands, you shouldn't use hot water. You should use lukewarm water. Hot water opens up the pores and lets bacteria out. Now, this is where I would have prepared my hands for surgery. Nowadays, all these open areas here should be closed for asepsis. This is the standard now for the UK. Unless you have this type of tap, you can't get your elbows down lower than your hands, because as I'll show you a bit later, you need to the water needs to flow from your hands onto your elbow. So the bacteria go from your hands onto your elbow rather than the water flowing from your elbow to your hands. So the bacteria is going onto your hands. Ashwin was saying that it's very difficult to find these sort of taps. Have you come across them, Tejas?
I have one in my clinic.
Okay.
Can you get it from where?
I can give you the guy's contact. He'll courier it to you. Delhi.
Great.
He also has a sensor tap. You don't have to use either a hand or a foot. You just place your hand and the water starts flowing.
Okay. Okay. Thanks.
By the way, how are we getting on adding the companies and the addresses of the companies of the instruments that we were going to do?
It's a slow and long process.
Has anybody started?
I have.
Good. Abby was very good about this, but what she gave me was the links, the Google links, which were miles long. What I needed was the name of the company that sold that particular instrument. Have you worked on that at all, Abby?
No, sir. I'll be working on it, sir.
Okay, have a go at that, okay.
Yes.
But these are now, if you were inspected now, as we have an inspection system in the UK, you'd have to have these sort of sinks. Here's an automatic soap dispenser. So this is the system that I've got. On the wall here is the procedure for preparing one's hands ready to glove for an aseptic procedure. Ashwin, I believe you've got this laminated and next to your sinks. Have you seen this at Eldo's, Akshay?
Yes, sir.
You have seen it?
Yeah.
Okay. Have you gone through this process yourself?
So this is for the hand washing or prior to the surgery?
Yes. Not just the routine hand washing, but for...
Yes, I have gone through it. Yes.
You have? Okay.
Yes, I've gone through it.
So you start in this process, you start by going through the normal hand washing that you do for general surgery, and then you go on to using the sponge. Do you have sponges, Akshay?
No.
Okay. So you need to use lukewarm water, as I've said. You see this person on the right here, and this is in that CD that I looked at. Do you see how she's letting the water go down onto her hands from the tap? Have you seen these types of overgloves, Ananth?
Yes, sir.
You have, okay. So I think that Tejas, I don't know whether you give me your views on this. If you were going to take an X-ray, you put some of these on over your normal gloves to take the X-ray, and then you take them off after taking the X-ray. Do you have some of these, Tejas? Tejas not with us.
So nowadays, we get these, we are asked to put it on in supermarkets over here.
Oh, really? Okay.
Yes.
You'd have to see if these are sterilizable, Ashwin.
Sorry?
You'd have to see that if you could sterilize them.
So it's not good. It's very flimsy. I don't think so.
Yeah, but you only need to put them on to take an X-ray over your normal gloves.
Yes. So no need, right? Why do you want to sterilize it?
Say it again?
I mean, asepsis in such procedures. Okay.
Yes. But you need to get hold of some and put them through your autoclave and make sure they don't melt.
Yeah.
Okay?
Mm.
So if you were,
You just
I've let him in. Tejas, I was just saying, you see this glove here? It's the sort that Ashwin's saying you wear them in supermarkets now. So I'm suggesting, Tejas, if you get some of these and check them in your autoclave to see if they don't, if they bear up to being sterilized.
I have these, so I'm going to check them tomorrow.
Yeah. Okay. So
You can
do you
just sorry. I was saying instead of using these over pre-sterile gloves, you can use autoclaved examination gloves, like how you pack them in the in the gusseted pouch.
yes.
So that would be. This is loose fitting. It makes holding things difficult. I use them for impressions when I use rubber-based materials, because if they come in contact with latex gloves, it affects the setting. So I
Okay.
wear over my examination gloves, and then I mix impression materials.
Right.
And it's difficult to grip anything with this. So I
Yeah.
think the better option would be to wear an autoclaved examination glove over the pre-sterile glove.
All you'd be doing is positioning the X-ray head.
Okay, then that should be okay.
Yeah. Okay. And what we with gloves, we would pack 3 in a pack. The normal examination gloves, we put 3 in a pack, which means that you put 2 of them on, and you've got a spare one which you put on the aseptic surface. And then if you need to re-glove, there's a sterile one ready for you. Okay? Don't buy pre-sterilized gloves. It's a waste of money.
Okay.
Also, if you had 2 of these gloves double bagged, and if you need to use the X-ray unit, then your roving assistant would drop these 2 onto the aseptic surface, and then you can put them on.
Okay.
Okay. And then when you take them off, you throw them on the floor.
Okay.
With latex gloves, are you using latex gloves or non-latex gloves? What's your situation as far as that's concerned?
Currently latex. Before pandemic, nitrile.
Sorry, are you using latex gloves, Tejas?
Yes, currently latex gloves. Before the pandemic began, I used to use nitrile gloves, non-latex.
Why have you changed?
It's too expensive now. Maybe in a couple of months, I'll switch back to nitrile once the prices stabilize.
Well, why were you using more gloves due to the virus?
No, but gloves are right now in short supply. So nitrile gloves are very expensive right now.
Oh, I see what you mean. Yes. Yeah. Yeah. Okay. The thing with latex gloves, you can get allergic dermatitis, non-allergic contact dermatitis. I had a friend who could not wear latex gloves because of this. So you can have a full allergic reaction. Abby, how are you now? What is your thinking about emergencies in the dental clinic? Because you were worried about that at one time.
Yes, I actually kind of made a medicine names, and I keep on remembering every day, most of the time, whenever I'm free. And I've been reading and attending webinars on medical emergencies.
Yes.
So I have made a booklet sort of. Yeah. So that's how I'm doing it.
How many of you have oxygen in your clinics?
I don't have.
Tejas, do you have oxygen?
No, I don't.
I think we here would have to have oxygen. And do you have emergency packs? A container with emergency drugs in? Is that
Yes.
required in India?
Say that again.
Do you have a pack with emergency drugs?
Yes, it's required.
Hmm. Do you have EpiPen? If a patient had an anaphylactic shock, what would you do? Ashwin, what would you do?
You give him chlorpheniramine injection. Avil injection.
Yes. I need to get EpiPen.
Chlorpheniramine maleate injection. Avil injection.
They have to have an injection of adrenaline, epinephrine.
Yeah, don't have so at the moment.
Now, Akshaya, if you had a patient with an anaphylactic shock and you had to find in the emergency box the syringe, the needle, and the bottle of, I think it's 1 in 1,000 epinephrine, isn't it, Tejas? Or is it 1 in 10,000? 1 in 1,000.
1 in 1,000.
Okay.
One in 10,000, I think.
No,
Is
1
it?
in 1,000.
1,000.
1 in 1,000?
1 in 10,000 is in it's one is 1,000.
Okay.
Okay. So the patient goes into respiratory decline. They've got a full anaphylactic shock. Okay. and
Yes, sir.
you go to the box, which has the epinephrine, the needles, and the syringes, and you break the top off the ampule, and you put the needle onto the syringe, and you draw up the liquid, and you put it in somebody's upper arm or upper leg,
Yes, sir.
right?
Yes. Yes.
Actually, what happens is that you go like this yourself, all right? And you go to the box, and there's all these other drugs in there, and you eventually, and the patient's going and got all blue, all right? And then you actually find what you're looking for, and you put the needle on the syringe, and you draw the stuff out, and eventually, when the patient's dead, you then stick it in their thigh. Okay?
Yes.
Now, with an EpiPen, you take the top off it, you stick it in the patient, and it shoots the stuff in automatically. Okay? The only unfortunate thing about EpiPen, and Tejas, you might research this. How much is an EpiPen?
I am actually researching it right now in the background.
Oh, right.
So it's 3,000, I guess.
It's expensive.
Yes. Okay. I think I've told one or two of you the story of a lady that I was teaching in Oregon, in Las Vegas. No, sorry, Los Angeles. And she was allergic to latex, and she carried an EpiPen with her. And I said, have you ever had an anaphylactic shock? She said, yes. And I said, were you in a state where you could use the EpiPen yourself? And she said, no. Somebody else did. And when they put it in, they put it the wrong way round. Akshaya?
Oh my gosh.
Akshaya? Okay. And it shot into his thumb.
All right.
I never actually.
EpiPen, sorry. EpiPen costs 50,000 rupees. $650. Two of them.
$50.
$600 for a pack of two.
Pack of two.
No,
Yes.
I can't believe that.
Is that cheap or expensive?
Well, in this country, I think in this country it'd be about 40 or 50 pounds.
Yeah, that's about the same.
No,
Is
it's
it?
not the same. 40
No,
pounds.
no, that's about, that's about 5,000 rupees. So this is like 6 times more expensive.
Yes.
That's
So
8 times.
Yeah.
We can load up 1 in 1,000 epinephrine in insulin syringes and keep it handy.
Yes.